let's turn to Abigail from the Southern Jamaica Plain Health Center. I think part of what's going on with Abigail and what she's going to tell us about just reminds us of what a group of people can start to do. We're talking about solutions and ways to start undoing certain things and getting at certain things. So Abigail, welcome and thank you.
Hi, thank you so much for having me. Great to just listen to what folks are saying. So I'm here to just talk about an initiative that we engaged in over the summer that we called Liberation in the Exam Room. And just by way of context, our health center, we have about 12,000 patients. We're in Jamaica Plain in Boston. And as a health center, we sort of have a real commitment to public health and thinking about the denominator population in our community. And over the years, I've been here for 12 years at the health center, we've gotten clearer about the impact that racism has on pretty much all the areas of social determinants: education, housing, healthcare, and really been educated about from our community organizing partners, from folks at the Boston Public Health Commission who have done some great work around this, about needing to get clear about how to talk about that. So we've done a lot of organizing. We've gotten engaged in transit work and employment organizing to work across different communities as a health center and step into that. And all along, a lot of our physicians and other medical folk have come to us and said, we really believe in this. We see the data. We see it's happening in the community. What do we do in the exam room? Like, how do I manifest this understanding in the exam room? So that was really what has, in each year we were like, we got to talk about this. We really want to learn more about this. We know about unconscious bias training. We've done some of that. We certainly know about diversity training, but it really wasn't fitting into our analysis of how racism worked. And I do want to say that we sort of unapologetically are leading with race. Our motto is we address racism explicitly but not exclusively. So we need to start with that lens to understand the epidemiology that we're seeing in our community. So, and I put this slide up just so that folk can see what we really see the differences, that racial justice work and any kind of anti-oppression work is not about diversity, because as they say at Race Forward, you can't just mix it up, you gotta fix it up. And equity to us is really about fairness, and that means that we have to look at systems. So the first thing we did with our group of docs, how we recruited them, is we just reached out to all of the folks who had shown interest, who had come to our racial justice trainings, who had engaged with us on health equity work and organizing work, and put the APB out over email, and every single person I emailed responded. So, and this is a range from residents to folk who are mid-career, medical directors. And I just felt this incredible hunger and thirst from people who wanted to have these conversations. We had the meetings at 7:30 in the morning throughout June. We had 3 meetings, and folks showed up and participated. And the first thing that we did was share a definition. So again, even on this call, I think we have to start to share glossaries and definitions about what it is we're talking about. So we use David Wellman's definition of racism, which is a system of advantage based on race, which operates at these 2 levels. Then we got our docs together and really had a conversation about how to build the container for these 3 meetings. And I know we have a lot of physicians on the call, and I'm part of the medical community, and we often think that doing this work is a neck up exercise, and it is not. I think we have to get more comfortable talking about how to integrate both your head and your heart, and do this work from a more of a values place. In many ways, a feeling is required, right? When we see that data from white medical students, if we're not having a feeling about that, I don't think it's going to really land, and I don't think we're going to really work on it. So these are the values that our group of physicians came up with. And then the next thing we did was looked at a huge lit review that a bunch of med students did for us. So we talked about implicit bias. We talked about cultural competency training. We pretty much threw cultural competency training out the window. We felt like that was more of a cookbook way of thinking about diversity and not a way of really looking at structures and systems. And we decided that implicit bias training was fabulous as long as it was part of a larger understanding about power. Because one person's bias isn't bias. As was already said, this stuff is, systemic, and it's bias is negatively toward folk of color, toward women are all, within the entire population. So it's not like everybody's bias has equal weight when it's played out around policies, procedures, and practices. And I think we can agree about that when we look at our data. So we sort of talked about implicit bias, but then we said, all right, so we're going to talk about our biases, but when we are being our most explicit, because I think the goal is to make what's implicit explicit, how do we manifest our understanding of structural racism in the exam room? And we asked the docs, what are you doing now? And I got to say, the first person who was a resident said, well, I think you just have to name it immediately. And he said that he has consistently been starting his yearly physical. And again, he actually works with only people of color. He's a white doc. And he said, the first thing I say is, a lot of my patients experience racism in healthcare, and I'm wondering if there's anything you'd like to share with me. And he said that it was the most effective first question. He said it worked so well from the first time he used it that he's used it consistently for a year, that it immediately created trust. It immediately demonstrated that he understood that this is structural. We can't just, even if all of us take the bias test and we all pass, the policies, practices, and procedures that create inequity aren't going to go away. We don't need any more bad actors to continue to perpetuate racial inequity and other forms of oppression. So I just listed a couple other things that docs had come up with. We decided that we were going to go away after these 3 sessions, do what we're calling our racial justice PDSAs. So that should, I know people have been trained in that, and that we would come back together in October and share what we've tried. And I'm happy to give more examples about what people are going to be working on, but I want to stop talking just so we have more time for questions.
Well, thank you so much, Abigail.